Hello and welcome to YourHealthTherapy. My name is Franklyn Webster, student of physical therapy, and today I'm going to be talking about some of the things that I've learned in physical therapy school, some of the courses that I've taken, and more importantly, why it matters to you because of a law called direct access. And if you're here just to learn what direct access is, there's a link in the description for exactly when in the video I'll be talking about that. So what have I learned? Well, I'm going to highlight some of the most important courses from those years and tell you a little bit about them. So here are some of the courses from my first year. The first course is Anatomy and Physiology. Now in Anatomy and Physiology, physical therapy students learn about muscles, bones, ligaments, tendons, organs, arteries, veins, and some schools even let you dissect a cadaver. My school did, and from that, I was able to basically look at a textbook, learn about it, and then actually see it in real life. This was an incredibly helpful experience, and it helped me sort of learn the body inside and out and really understand anatomy to its fullest. The next course is called Physical Therapy Process. Now this course is basically where you learn the textbook positions of testing muscles, testing the range of motion of different joints to see where there might be limitations in patients. Also, it was the first course we learned how to transfer patients from a chair to their bed or the bed to the chair, help patients to walk, identify some of the things wrong with this, which we'll learn more about later on. And this is a lot of the physical therapy skills that you'll see if you've ever been to the hospital for a surgery. They're the ones that help get you out of bed for the first time, help you walk around and decide when it's time for you to go home and when you're safe to do so. In kinesiology, we learned how joints move, and it's not how you would expect. It doesn't just bend. Certain bones have to roll and slide to create the motions that we see. This is also where we learned about something called muscle synergies, where our muscles contract in a specific way to produce the emotion that we see. This is like when you raise your arm up like this. There are several muscles back in your back that actually have to rotate your shoulder blade in order to produce the full motion of this motion, which is called shoulder flexion. You also see a lot of these synergies in gait or when you walk. Speaking of which, we actually had a course a few months later called gait. With this course, we learned all the different muscle functions, when they're on, when they're off, and every single phase of when you first put your foot down, to when it's swinging in the air, and to when it's put down again. This course gives a good perspective into how to help people improve how they walk to make it easier, especially if they're having trouble and there's just a minor tweaks that we can make that can make a world of a difference. This next course is called Musculoskeletal, and in this course, we take the concepts of anatomy and physiology and kinesiology and put it in together into evaluation techniques and treatment techniques. And from this, we learn that we can make physical therapy-based diagnoses, such as the patient has low back pain with mobility deficits with extension directional preference, consistent with disc herniation pressing on nerve root. This basically means that I'm just saying that their symptoms point to a disc disruption. I'm not actually diagnosing a disc herniation because I don't have the MRI to really see what's going on there, but my exam is structured well enough to be able to tell me what it is most likely, and I could treat you and you can get better without me ever seeing the imaging. This next course is called Pathophysiology. And in this class, we learned about all the other body systems and things that could go wrong there. This is especially important because we talk a lot about things called red flags in this class. These are symptoms from other parts of your body that might present with my examination, things that I might see and might want to refer you to a different doctor for. So here are some of the courses from my second year. Now in the start of my second year, it started out with a fall 10-week clinical affiliation where I practice under a licensed physical therapist to help guide me as a new clinician. And in this experience, I learned a lot about how to properly document with the time constraints of a PT clinic, how to properly bill for insurance, and worked on my skills with communicating with patients. This next course is called Acute Care and Cardiology. In this course, we learned a lot more about treating patients in the hospital, how to do it safely, accounting for recent surgeries to things like your heart and lungs, and get patients back to their normal lives from the hospital. We also learn about exercises to help with breathing, such as pursed lip breathing, active cycles of breathing, posture related to how you breathe to help your lungs get more oxygen to your body and reduce stress on your heart. We also learned about something called cardiac rehab, which is a program to help people who had heart surgeries or trouble with the heart get back to an active lifestyle. This next course is called Neuro Rehabilitation. It helped us learn how to treat and help restore function in people's lives who have certain neurological conditions, such as Parkinson's, multiple sclerosis, traumatic brain injury, stroke, spinal cord injury, and the list goes on and on. We also learned certain evaluations to assess balance, tone, coordination, spasticity. We also learned about things to treat your vestibular system, or you're also called your inner ear. And for a lot of older females, they have trouble with this, and they get what's called vertigo, which is just dizziness, and a certain type can actually be fixed very, very easily with physical therapy. And lastly, we had a class called Differential Diagnosis. Now in this class, this is where the black and white of the musculoskeletal treatment and evaluations kind of got gray, because we learned that just because certain things are positive in our tests doesn't always mean that it is a certain thing. We learned a lot of problem solving skills and how to really work with patients to get them better, even when it's not a condition that we can treat, and basically who to refer them out to. Here we learn about hot and cold thinking, which is basically your hot thinking is your quick thinking, your intuition, your quick judgments, while your cold thinking is your analytical thinking. It's very slow. It's made up of careful considerations. From this class, we analyze how we think and the different errors with thinking so we can help not make those errors in the future. Honorable mentions for class that I've taken are Pharmacology 1 and 2. We learn about considerations for physical therapy. Diagnostic imaging is a class we also took, taught us about how to read MRIs, X-rays, CAT scans, other scans, and interpret those results and match it to our clinical tests. We also took, of course, evidence and practice. We learned about research, how to properly read it and determine which studies are awesome and which studies are garbage. We also took a course called Capstone, which we do our own research projects. And lastly, we took a course called Physical Agents, which taught us how the safety and proper usage of heat, ice, ultrasound, electrical simulation, and all. Now there are a few courses that I'm still taking today, which include pediatrics for basically young patients and how to treat them properly. We're also taking advanced clinical decision making, which is a continuation of differential diagnosis to basically further refine our thought process and our evaluation and treatment clinical reasoning. And I'm taking exercise prescription, which helps with understanding the correct dosage to prescribe exercise with, to basically get the changes that I want to happen in someone's body to occur. And prosthetics and orthotics to learn about, prosthetics and orthotics and how they're properly used and how to take them on and take them off for specific patients and different reasons of why they would be used for those patients. So let's get to the point. Why am I telling you all this? Well, two reasons. One, in case you want to go to physical therapy school and are interested in the types of courses that you take. And two, because of a law called direct access. Now, direct access is a law that is in effect in all states as of January 2015. This law may differ from state to state, but generally it goes along the lines of you don't need a referral to see a PT, and you could walk in off the street or call, make an appointment, and sometimes be even seen that same day. So I gave you an overview of different kinds of things a physical therapist has to know to help you understand why physical therapists are now primary care providers for neuromuscular conditions such as muscle strains, ligament sprains, sudden pain from activity, or slow worsening pain from activity, and neuromuscular conditions such as general muscle weakness, trouble walking or getting out of a chair, and for specific neuromuscular conditions for maintenance of function, such as multiple sclerosis and Parkinson's disease. So if you have any of these conditions and you have not already, see a PT. Physical therapists are trained to assess your motion, to see if you are our patient or you're someone else's by having a wide background of lots of different conditions of the body and knowing the red flags to know if it's something going on with the organs. An example of this would be shoulder pain that only increases when you're walking upstairs. This can be a sign of a heart condition. Also, shoulder pain can be coming from your neck, your upper back, or even a rib. The main point I'm trying to get across is that your pain can be a bunch of different things, and physical therapists are trained to be the movement experts and have physical exams that are designed to figure out what's going on and help differentiate between what could be causing your pain, which is a lot of different things, and what's truly causing your pain. Well, I hope you enjoyed this video. Please comment and like on this video if you want to leave feedback. I really appreciate it. And till next time, this is Franklyn Webster with Your Health Therapy telling you to stay informed and stay healthy.